Welcome everyone to Healthcare for All, brought to you by WCANradio.com. This program examines the issues of healthcare for you. Join us now in the studio where the program is in progress.
And welcome to Healthcare for All. Your host tonight will be Debbie Silverstein. Debbie, how are you this evening?
I'm good, Eric. How are you?
I'm doing wonderful. I see that you brought two guests with you tonight.
Yes, I did. I brought with me Michelle Mahon from National Nurses United here in Ohio. She's a community organizer with them. And I also have with us Donna Smith, who is also with National Nurses United and is also a community organizer and a very good spokesperson for single-payer health care.
Well, I'd like to welcome the both of you to the show. As you know, Debbie is the host of the show, so we're going to get right into it this evening. We're going to start talking about some healthcare issues.
Okay. Well, I'd like to start. Donna, are you there?
I'm here, Debbie.
Great. Donna, you have a story to tell about healthcare. Can you share that with us?
Sure. My own story is like that of millions of Americans. It was chronicled in Michael Moore's film Sicko in 2007, but it's not unlike those still playing out in increasing numbers. Families that have carried health insurance and always did so or tried to always do so, and when they got sick, they found out just how inadequate their health insurance is. Not even through denials. Ours was not a case of denials, but a case of not having the insurance be adequate to cover what we needed for our health care needs and keep us going financially, even though both of us work full-time jobs. We ended up slowly but steadily losing everything we had and eventually our home, and had to move in with our daughter, and it just was a very horrible process to have happen after you thought you had played by all those unwritten rules we all have for us. So healthcare in this country is in a mess, as we all know, and I think that there are so many people out there who think that the stories they heard in Sicko were there because they were unique, when it's actually just the opposite. Those stories are in the movie not because they were unique, but because they were not unique, and they're so common in this broken system.
Well, you know, what happened to you happens to about 1 million people every year. Isn't that true?
It's true. We ended up declaring bankruptcy eventually. It was a horrible decision and conclusion to eventually come to. And I was just listening again last night to Elizabeth Warren of Harvard, who was the person in charge of looking over the TARP situation, but also now is running for the Senate in Massachusetts. But I was listening to comments she made again last night, where she talked about the fact that of the people who go bankrupt in this country, close to 60% did so because of medical crisis, and of that 60%, 75% of those people had health insurance. So it's a horrible problem, and it not only in the inhumanity it does to those individuals in the situation, but if we think about how that snowballs into our communities and into the economy and into everything around us, the trauma of it is tremendous.
It is, and it's something that most of us don't realize, that the average American is just one major illness away from financial ruin, despite having insurance.
So very true. I think you can go along for a while thinking that so long as you purchase that insurance, and my husband and I were not foolish either. We saw the same drift that so many people see, premiums going up and coverage shrinking. So we bought a small disability insurance coverage and even had a little healthcare savings account on top of that, but it just was no match when you find yourself in a situation of being ill and having the bills mounting, and you may not be working quite as much as you were, so your income may be sluggish. It's very hard to keep up with all of that, and the thing you're going to have to keep up with if you want to stay alive is paying those out-of-pocket costs and the deductibles and the medicine and the costs of your medications. And so everything else slips behind, and you can end up in a world of hurt very quickly.
Oh, very definitely, because one of the things that's happening is with the cost of the insurance going up and up and up, we're finding that more of the costs are being shifted to the individual. And if you have any kind of a choice in your insurance plan, and this is one I'm going to be faced with in the next year or two, you end up going to the one with the higher deductible and the higher copay because you can't afford the premiums for the one that might cover you better. And then that's how you get in trouble. And keeping up with all those copays and deductibles, I was talking to a friend of mine who works at a Cleveland hospital, and if you have an outstanding bill and you need to come in for an appointment or anything like that, they will not make that appointment for you until that bill is paid up.
It's a horrific thing, and it becomes even pretty ridiculous. We had a situation just a couple of years ago and didn't even realize, and I'm not exaggerating, my husband had a $7.50 balance with one of the major laboratory companies in this country that he was unaware of, and he went to have blood work drawn, and they stopped him from having his blood work drawn because of this outstanding $7.50 bill. And it was just, he now, thank God, has aged into Medicare, but we purchased a supplemental policy for him right now that's almost $300 a month. On top of that, we went to pick up one of his medications just yesterday at the pharmacy, and his out-of-pocket, even with all that coverage, was $94.
Oh, my goodness.
I have to say something here. A lot of people that are, part of the working force that do pay for insurance, pay for medical insurance, are under the impression that even if the cost is going up, there's still going to be adequate coverage. And you're saying that that's not quite so.
It's not quite so, and it can often be very hard to tell it. Let me tell you some of what we experience, which many people experience. The insurance companies have become very adept at setting contract rates with certain providers and certain doctors. So you may even go to a doctor that's a part of your plan, and that doctor may order a procedure or a test or want you to have something done, and you go to a facility that's part of your insurance company's plan, whether or not that one's close to home or not. And we would get done, and we would think, oh, that's good. We're going to have, we might even plan for what the deductible was, maybe $100 or $150, which is bad enough sometimes when you're ill. But then bills would start to roll in from people who somehow touched that procedure of yours, either read a test or provided some external service to that hospital, whether it was an anesthesiology group or some other group that did something for that test that, they're not a part of your contracted rate with your insurance company, your preferred rate, so you end up getting a bill at a much higher rate than you would have otherwise, a bill you didn't anticipate, sometimes for hundreds of dollars.
Well, wait a minute. Let me ask. So then you're saying then that these other people who are touching your bill, they're not all inclusive in that medical plan?
No, they're not. That's happened to me.
No, they're not. They may or they may not be. And what choice here was our frustration is what you may even when you sign those papers when you're admitted to a healthcare facility, you're signing an assumption of risk and responsibility, of financial responsibility, and you sign that no matter what's left at the end of the day, you're going to be responsible for that as a patient. So even if your insurance company pays at the proper rate all the things in that provider, there may be one or two providers attached to what was done that are at a different rate or a much lesser rate, and you end up socked with a bill, and you've signed that you're responsible for it. And I have to promise people, some of the most aggressive collectors on the planet are some of those corporate healthcare providers. I'm sorry to tell people that, but it's not a surprise to many people because you know how quickly the collection notices start rolling in if you don't pay that bill in full.
Oh, yeah, I had a regular pen pal, named attorney at law with my situation. Mm-hmm. Because, what it is, they tell you have to be a smart healthcare consumer. So despite being in horrendous pain with a kidney stone, I did my homework. I was, up in Michigan visiting family, and I found and made sure that I was going to a network facility to be cared for. And when I got there, I verified with the people when I was checking in whether it was a network facility, and they said yes. And so I went into emergency, and they sent me for a CAT scan, and everything was fine because I was in my network and that type of thing. Well, the radiologists that read that CAT scan were not. And these guys were not employees of the hospital. They were contracted by the hospital. They had an exclusive contract with the hospital, They had to read every film that was done, and they were the only ones who could read those films. So the emergency room doctor couldn't do it and say, yeah, it's a kidney stone. It had to be one of those radiologists, and they were not in the network. So what should have cost me, according to network charges, $110, cost me $450. So I sent them a check for the $110, and I said, this is the network charge. I don't understand why, if you're at this network facility, you don't join the network. I said, but I'm not sending you any more until I know, first of all, who am I paying, because I've never met this individual, and what exactly did he do to earn this money? What calculations did he perform? How long did it take him? What did he have to do? The response I got was a letter back from attorney at law.
I'm sorry that happened to you, but I know it's happening all over the country, and a great deal. It happens a lot to people, and I tell folks, we often think of the health insurance industry. People get confused that health insurance is the same thing as health care. It is not the same thing. The health insurance industry is a financial services industry. They are designed to provide what they say is to us financial protection. But I don't know of any other area of our financial lives where we sign away so much of our rights and accept so much financial responsibility without full disclosure of what we may be taking on. It's really a horrible situation. And like Debbie, what were you supposed to do with a kidney stone? I mean, what are people supposed to do when they need the care and they appear somewhere, they try and be responsible, they try and go where the insurance company says they should, and they end up in a mess financially. It's so not right, and it really speaks to why we have to move to a more sane system of health care, not just because of the humanity of it. That would be enough for me and most of the people I know, but also for just the economic humanity of it and the legality of it, in my opinion. I feel like I'm defrauded sometimes.
You've expressed a real horrendous event. But how can a person, until we've moved on to that, more secure health plan, how do we protect ourselves? How does the average person go about protecting themselves?
Sometimes you can't, Eric.
I think what Debbie explained, her scenario, is the best that you can do. It truly is the best that you can do. Is you, when one of those bills arrives, you do the very best you can to ask at the outset if you're capable of it. If you're conscious, and if you can actually do that, you ask and you find out, is there anyone going to touch what's happening to me that is not part of my network insurance? And if the answer is yes, is there another way that I can get this done? Can someone else read it who is a part of my plan? What Debbie described is a situation that's all too common. The hospital itself has contracted exclusively with someone else to read those films, to take care of whatever that test is. In that case, there's nothing the consumer can do but say, I went to a network facility, and fire right back a letter and do as much as you can to say, I've paid you what the contracted amount is, and I'm going to protest this as high as I have to go within not only my insurance company but to my state insurance commissioner. But what a horrific thing to have to do when you're facing illness, too. It's not right. And it may not be successful. Ultimately, you may end up responsible for paying that hundreds, or have it be one of the things they aggressively go after to collect you, all the way to small claims court, all the way to garnishment of your wages, and all the way to forcing you into bankruptcy if that's what they want to do.
Mm-hmm. Absolutely.
Wow.
Well, they were very aggressive with me, but I was just as aggressive back.
Mm-hmm. Mm-hmm.
Good for you.
So now, who is at fault? The insurance company for allowing this to happen to you, or is it the individual that hasn't investigated enough?
It's the whole system, Eric. Mm-hmm. It's the whole way the system is set up. If they don't have to be a part of the network that the hospital is a part of, and this is where you find most of this happening, then why would they want to be a part of that network? They're going to get the work anyways. But it just goes to show that the whole thing here is we look at healthcare as being a marketplace commodity, and we've got people telling us that the marketplace will take care of it. Mm-hmm. This is not a real marketplace.
It just seems that it would be a benefit to the hospital that was inside of a network to have network people. I mean, it would make life so much easier for them and for the patients.
Well, it wasn't the hospital's problem that these people weren't in the network. It was my problem. It's only my problem.
It only becomes the hospital problem if the patient has an option to go somewhere else and they can choose to do so. And so, but why should any of us, here's my point, Eric, is why should any of us, when we're faced with an illness in our lives, have to make those kinds of calculations? That this is insanity, and the system is what's broken. You know, the hospitals a lot of times will have somebody connect because they don't want to take on the liability of having somebody misread a film or whatever. They want that liability housed outside of their legal parameter, or maybe they don't make enough money by having those people on their own staff or paying them. There may be any number of reasons why a hospital might not want to have somebody reading those films on staff, on call, ready to do that, who's under their tutelage and a part of that health insurance network. So in reality, you can't fix all of that. The system itself with healthcare is so broken that we've got to clean it out. It's got to stop. Profit has to stop being the motive in delivery of healthcare so that all of us don't have to worry about that. I was sitting, I'm actually having to have some medical tests done right now, and I was sitting in a doctor's office today thinking how insane it is for anyone to think that all of us want to sit around doctors' waiting rooms and hospital waiting rooms waiting to get a lot of health care done. That's not my favorite activity. I don't know anybody who really loves that. So we've just got to fix the whole system.
Okay, if we went to the single-payer plan, how then would that fix it?
We have to fight for it. And in the meantime, we have to be as smart as we can be and advocate for ourselves. And like Debbie did and like I've had to do, you have to get as assertive as you possibly have to be on your own behalf and standing up for yourself, but know in the end that you may not win, and that's part of why we have to fight for single payer.
Right.
Oh, okay, then let's talk about single payer. Give me the numbers. How will it fix this problem? Somebody, anybody.
Oh, I can tell you easily. First of all, the problem that I had is I would have been covered fully in that. There wouldn't have been network and out-of-network providers. It would have been simply a provider, and it would have been covered totally. Because every single payer bill that I've read calls for total coverage, no deductible, no copay. So if I had that kidney stone, I go, whatever is deemed medically necessary, they do, and the single payer system pays for it.
Mm-hmm.
So I wouldn't have had to worry about...
So nothing out of pocket.
Yeah, right. Mm-hmm. Well, you see, the other part of that is they told me if I couldn't pass the kidney stone, I'd have to see a urologist. So I started looking up urologists. Well, there wasn't one in my network in a 50-mile radius of where I was.
Yeah, that all ends under a single-payer system, too. I think that the best thing for me as a patient or as somebody who has to care for a patient is to know that I won't have to think about all that stuff. That won't be mine to worry about. My worry will be taking myself or my loved one to the closest facility if I have an emergent problem, to the closest facility, or to the facility of my choice and the doctor of my choice, the doctor that I like best to help me care for my health, the facility I trust most to help care for my health. The place, and I'm going to feel so much more comfortable knowing that I don't have to worry about whether the radiologist has a preferred contract with the hospital. I don't really care about that. I care about having high-quality health care, as the nurses have been so wonderfully eloquent about. Having a single standard of high-quality health care for everyone is the right way to go. That's what single-payer allows us to do in a more efficient way and a more financially responsible way. It's a win-win. The only people that don't win are the financial services industry, which is the health insurance industry, and the large corporate providers that are making a huge amount of money on keeping things the way they are.
Well, we have a healthcare provider here in the room. Michelle is a registered nurse. Is there anything that you can tell us that we could do to protect ourselves until we can get a single-payer system or a system that works for the patient rather than for the financial wizards?
Well, I think that it's really important. I tell as a nurse, first of all and foremost, it's really important to have an advocate. I think that everybody, if they're able, should have somebody they trust with them to come with them at the hospital. It's first and foremost, more than, as we talked about already, when you go to the hospital, you're not really worried about the bill. You're worried about being well. you're worried about. Many times it's an emergency, or you wouldn't be in the hospital. Patients in the hospital today are very, very, very ill. Otherwise, they're at home or in an outpatient clinic. So if somebody you know is in the hospital, you should be there with them if you can, or designate somebody to come and advocate for you while you're in the hospital. I think that's really important. Of course, what's really alarming is that is not an option for everybody. Some people don't have a resource, and and it's really scary. You read these patient bill of rights now in the hospital, and they really talk a lot about being a responsible patient.
Mm-hmm.
And I find that so ironic. So many patients I've cared for, some of them can't even talk to me.
Mm-hmm.
And it says, be sure to watch how fast your IV drips so that you know if it's going in at the right rate. Well, the last time I checked, that was my job.
Right.
So, it's really, and one of the reasons that, it's become so challenging to be a patient or the family of a patient is that, is exactly that, is what we're talking about. How do we pay for our health care? How do we finance our health care?
Well, let me ask a question. If you're going in as an advocate, how do you approach the doctor about, the level of care that he's receiving, that a patient is receiving, and how it's going to be paid for? That's not a doctor's responsibility, is it?
No, it's, it really is a challenge, and that's why we nurses, we've come up with a plan.
Mm-hmm.
And what we call it is the Main Street Contract for America. And we really think, of course, we think as nurses that everybody should have health care and that people should be able to be well in an environment that is promotive of that,
Mm-hmm.
as well as an environment that's free from leading you ultimately into medical bankruptcy or all of these
Mm-hmm.
other horrible side effects of being a well person. But we think that that's not enough right now.
Well, and part of that is, when you think about it, the nurses treat, the whole person. And it's not just the illness that brings you there. It's everything else that comes in with you. And I saw that, I was a teacher. I wasn't just teaching math to a high school student. I was teaching kids, first of all. And I was teaching kids with all of the bags and baggage that they brought with them to school. And and the math part of it, that is the subject I was teaching, but I had to keep remembering I was teaching kids. You are taking care of patients. They're human beings, and it's not just the appendicitis or the kidney problem or the liver problem or whatever it is that they might have, but it's everything else that's going on in their lives as well. And that all has to come together to make for a healthy society.
That's right. When we assess our patients, we're seeing so many things right now as a result of the economic calamity that this country is in. More people are unemployed than ever. Those who have jobs aren't really having access to very good jobs. We're seeing that patients are deferring their medical care so that they can buy food. They're having to choose between their medication and their mortgage. They're seeing their doctor for an exam, and their food. So it's all very subsistence. We're seeing that on the opposite end of the spectrum. The elderly. People are proposing cuts to those things, and that the services that they need to survive. So people are really, it's kind of crumbling down. People are really hurting. They're really hurting. Since this economic crisis collapse in 2008, we have seen an increase in stress-related illness. People are coming to the emergency department with, unfortunately, there's been an increase in suicide attempts. So these are real illnesses that are affecting real people as a result of real economic crisis.
Mm-hmm. Yeah.
So that's what we're seeing in our communities. Some of us are even seeing that in our own families.
Right.
You know, it's not isolated to our patients. It's our neighbors, it's our mothers, it's ourselves. We've just kind of said it's enough. It's time to come up with a plan that works for everybody to heal America, as we've been saying.
All
Right.
right. Well,
No.
well, now, how do we come up with a plan then to educate the masses?
Well, one of the things is we're right here on this radio show right now.
That's
So,
one of the things, you know, and we go out and we speak whenever we can to any group that will have us in and that type of thing. And the other thing, too, is, and I joined Michelle with this one, we hold public rallies. We go out in public, and anywhere in a public place we might put on a little skit or something like that. Last September, we went and visited the office of Representative Steve LaTourette up in Paynesville, and we presented Steve LaTourette, Michelle did, with some of her nurse friends, with the Main Street contract, and asked for his endorsement, and we had a little skit out on the public green.
I tell you what, before we go to the skit, we'll be right back.
At eHarmony, you don't scan through thousands of pictures looking for your perfect match. Where's the value in that? We pre-screen each and every member for you to determine your matches based on compatibility. So when you get to that first date, you know you'll have something in common. eHarmony does the matching for you based on who you are at the deepest level. Aren't you curious to see who you'd be matched with? Log on to eHarmony.com, where it's absolutely free to review your matches.
Bicycle, what are we waiting for? The flowers are blooming, the air is sweet, and Zyrtec starts relieving my allergies 2 hours faster than Claritin. My worst symptoms feel better, indoors and outdoors. With Zyrtec, the fastest 24-hour allergy medicine, I promise not to wait as long to go for our ride. Zyrtec works fast, so I can love the air.
At JCPenney, you'll find more things that last
Because we put quality first. We feel better.
and look brighter.
With more things made to stand up
More things designed to lie down.
and more things you can count on.
Over.
And over.
And while quality is something we look for first,
Our great values have made us.
a name that lasts.
May I help you?
Hi, I'm looking to save on car insurance, but it's got to be right for me.
Well, let's check out the Dave aisle.
Excuse me?
The Dave aisle, where your perfect policy is customized just for you. It's all here. The coverage you want, any discounts you get, all at a great price.
I have an aisle. Why is that guy in my aisle?
That's Steve. He works here.
Okay.
Getting just what you want at the right price. Now that's Progressive. Call or click today.
And welcome back to Healthcare for All. Now, I'd like to encourage our listening audience that if you'd like to become a part of tonight's show, you can do so by dialing 1-800-921-2204. That's 1-800-921-2204, or you can send us an email to wcanradio@yahoo.com. And Debbie, we left off about, educating the masses. You were telling us about a skit.
Yeah, well, we were saying we went to Steve LaTourette's office, and we did the skit, and we also presented him with the Main Street contract. And Michelle, have you ever heard back from Representative LaTourette?
Nope. Still no word on whether or not he's with Main Street or if he's with Wall Street.
Which was the question that was put to him. So I don't know. There might be something in the contract that would be objectionable. Have you ever heard of the Main Street contract, Eric?
No, I haven't.
All right, we'll try it out on you. Donna, you've heard of it, right?
Oh, of course I
Yes,
have.
you have. Okay, so you can help us answer any of Eric's objections, right?
Sure.
Okay, the first part of it is the first thing, jobs at living wages, reinvesting in America.
Jobs at living wages, reinvesting in America.
Yeah, is that objectionable?
No, it's not.
Okay.
Jobs at living wages, investing in America.
Okay, so that's not the reason why he hasn't answered you, Michelle. What's the next one?
Equal access to quality public education?
Yes, we should all have that.
I think so.
Guaranteed health care for all.
Yes.
I like that.
Yeah.
A secure retirement with the ability to retire in dignity.
Yes, by all means.
So
yeah, especially since I just heard the release tonight that said many Americans plan to work until they're at least 80, which will be tough since our life expectancy isn't that yet.
Oh my gosh.
Okay, so we'll be working while we're in the grave. Okay. Good housing and protection from hunger.
Yes, as long as it's within my financial reach, yes.
Yeah.
How about a safe, clean, and healthy environment?
By all means.
A just taxation system where corporations and the wealthy pay their fair share.
Yes, by all means, definitely. I'm all for it.
So there's nothing here that you would take issue with?
No, nothing.
So what do you think is there that Mr. LaTourette has not responded to us?
I don't know. Let's give him a call and find out.
I think we should.
I think everybody listening should give him a call.
Yes,
Absolutely,
yes, by all
absolutely.
means, definitely.
Join us at our follow-up rally in Painesville, date to be announced.
Okay. Okay. Well, you know something that I have been playing pretty much the devil's advocate simply because most of the American people out there today think that the health care that they're paying for is in fact adequate. And they would be more than willing to say that a lot of what you have described already are just unique situations. And it's really not. I believed earlier on you said that 44.5% of the people that are actually gainfully employed are not, or it's just 44.5% that are receiving medical insurance from their employers.
Yeah, there was a recent survey that showed that the number of employers that are providing their employees with health care has gone down, and it has continued to go down since about, steadily since about the year 2000. We're down to about 44.5% of the employed people have insurance through their employers. There are many people who are employed that do not have insurance, and when we're talking about the uninsured, the totally uninsured, many of those are employed. I met with a state senator in Ohio. I think it's your state senator, Michelle.
Oh, you must mean Tom Patton?
Yeah, who told me if I was there to talk to him about the uninsured that I was barking up the wrong tree.
That's right.
And there was no problem with health care in, here because there aren't piles of dead bodies outside the ER.
Wow.
They're just in the hallways.
I think a lot of people, they think that's the evidence they need to see, when in fact, I always tell people it's a real quiet and insidious crisis that happens oftentimes. I know Michelle, as a registered nurse, often sees the most horrific and glaring details at the bedside, but I think that sometimes, think about how you yourself feel, Eric, or any one of us feels when you're failing financially. Mm-hmm. It's a very shameful thing in this country. We often try and hide it from one another when we're having financial trouble. We don't want an employer to know that a collector's tried to reach us at work. We don't want them to know we have financial trouble. In fact, if you have a bad credit rating, it can sometimes affect your ability to get a job or even rent a home or certainly to borrow any money anywhere. So we make it a very shameful thing to have financial trouble. It's a quiet crisis that happens. And oftentimes by the time somebody lets another person know that they're hurting badly enough, their health has already suffered tremendously because not only of the stress, but they may have been ill with a chronic kind of illness that they were not treated for in any way, and it's become a much more serious thing over time. Mm-hmm. So that's a very ill-informed and ignorant comment from someone to think you should wait until you see dead bodies, piling up somewhere. They're piling up, but they're piling up in a more quiet way and in a way that can't be seen out in the streets. Maybe not until now, when some of our younger people are stepping forward. Some of us aren't out there with the Occupy folks in the street, but there's certainly some people stepping up now.
Well, is health care part of an issue for the Occupy movement?
I think There's a lot of people who are really pushing for that in the Occupy movement. I always laugh about the mainstream media, and I hope that we all will help educate. They try and say that the Occupy folks don't have any demands. Well, that's not true. There are a lot of things the Occupy movement has been talking about, along with taxing the wealthy and fairly taxing corporations and making sure there's a just and safe healthcare system. And making sure we have a quality public education, that young people don't come out of college with debt from student loans that they can't ever pay off in the course of time. So there's a lot of different issues that the Occupy movement are speaking to, and under the umbrella of we are the 99%. 99% of us don't have access to what that 1% of the very wealthy do. So yes, healthcare is definitely one of the things that's being expressed.
Well, interesting you should make that comment, Donna, because we've got an email question here from Judy from Columbiana County, who asks that very thing, and she says she wants to know why it is that people like Dick Cheney and other millionaires are provided with the very best health care that they want to deny to the rest of us.
That's right. The Cadillac care, they get it.
Yeah.
That's right.
Of course, I say too, when you're looking at the Congress, and they started talking about Cadillac health care plans. Mine is supposedly a Cadillac health care plan, and I did say that they deserved an award a literary award in fiction for the title of their Healthcare Reform Act, the Affordable Care Act, because I haven't found anything affordable in there yet. These people, we pay them more than three times median household income for a salary. We pay them a salary that puts them in the top 5% of income earners. And many of them are millionaires in their own right. What do they know about what's affordable to us?
Well, I think one of the other shocking things I find out, I live and work. I work for the nurses and live close to Washington, D.C., so I have occasion to go touch up our congressman up close and personally with the issues the nurses are working on. And one of the interesting things, every single congressional building, office building, has a congressional health office in it. And I was very curious about what that congressional health office was, because so many of the congressional members pretend not to understand why we would need a single-payer system. What in the world would we need that for? When in reality, if they feel sick, if they need physical therapy, if they need a throat culture, if they need a flu shot, if they need just basic health care services, they have a congressional health office in the building that you and I are paying for as taxpayers. We're paying for that. They go in and they get that care. They don't have to worry about a copay or a deductible or any of those kinds of things. So on top of having access to a better range of health care coverage options as congressional members, they understand exactly what it's like not to worry about being treated when they're sick, because they can walk right down the hall and do it.
Mm-hmm.
Yep, that's right.
Now, is that option also open to their families?
No, I don't think it is. However, one of the interesting things was, and I've always thought this would be a very interesting kind of thing to test out, is that the health services in those buildings are also open for should anyone fall ill, because it's a public building and people can go in. Should anybody fall ill while they're in the congressional buildings, there's a doctor and there's people present to help treat them. I thought, wouldn't it be interesting if a great number of us suddenly felt ill?
Oh, Donna, I think you're on to something. I really do. I didn't know that, but I think I'll try that out the next time I'm in D.C.
Betty, next time you have a kidney stone, sweetheart, I'd go to one of the congressional office buildings.
Well, yeah, I'm certainly not going back to the place I went the last time. That kidney stone cost me a month's income out of pocket, and that was over what my insurance paid.
Well, how convenient would it be if we all had a doctor and everything we needed right where we worked? So all we needed to do is just go down to the, right there. It's right
down
there.
To the clinic.
It's available and ready to go. I mean, gosh, when you're sick, it's hard enough to even get out of the house, right? So yeah. There you have it.
Tell me about it. I mean, sometimes you're
I
so
walked
sick.
by one of the offices one day, and I thought, kind of like the congressional gym story we all heard told some time ago on, I think, CBS or 60 Minutes did a expose on the congressional gyms and what kind of sports services and exercise services they have available, which are fine. I have no problem with them having access to treadmills and those kinds of things. Many of the congressional members do work long hours. I know we are always disparaging of them, but many of them do work very long hours, and some try to do what they feel is right. I don't have any problem with that. But then when I saw this health office, I thought, how interesting is that? I need to know what that's all about. So not one of them anymore can tell me they don't understand single-payer health care. Not one of them.
Okay.
They're all participating in it.
Well, I tell you what, let me ask a question then. Let's look at single-payer plan. For the average American that's making $20,000 to $40,000 a year with a family of maybe 2 children, husband and wife, the single-payer plan, what is that going to put back into his pocket? Or into that family's pocket? What is it? What kind of disposable income is it going to give to them? Can anybody give me numbers on that?
It's going to depend on what they're paying right now. If they have no insurance right now and they're paying doctor bills out of pocket, then all of that money would go back into their pockets.
Right. But if they're paying, let's say, like the average family, for a family plan, upwards of $400 or $500 a month.
Well, most of that would come back in their pocket, plus any medical expenses. You know, and it's hard to really say because there's various plans out there and proposals for funding this on what kind of premium contribution would be asked for. I sat down with the Ohio plans and I sat down with H.R. 676, which is the national single-payer bill in Congress, and looked at the payment structures, the funding structures for those. And the national bill would put about $200 a month back in my pocket. Now, I'm Miss Median Household Income Ohio because I'm right there at the median household income rate. You know, I'm paying 25% of my health insurance, plus 100% of vision and 100% of dental.
Right.
And that. So all of that would come back into my pocket, what I'm putting out for those insurances right there. And, you know, and part of it is, too, and it's important to remember that these bills also cover vision and dental and mental health.
Well, and don't forget that we all pay our taxes. We're all paying anyway, and if we're all paying for health care, and in the current situation, we're paying for health care we don't necessarily even need. Many people are. The well-insured are maybe even getting care that's not necessary. And
well, what do you mean by they're getting care that's not even necessary?
Well,
what kind of care is
procedures
that?
like, well, for example, you know, we're getting we have so many things that are segmented. We're seeing a lot. Imagine if you live near a medical center, you may see an abrupt rise of these urgent care centers that are like, you know, as a matter of fact, I live in Strongsville, not too far from here, and there's one across the street. There's 2 right across the street from each other, and one belongs to the Cleveland Clinic system, and one belongs to University Hospital system.
All right.
And so now everybody's absorbing somehow these costs, right, for both of these facilities directly 500 feet away from each other. Because they're insurance driven, and each one of those facilities makes money.
Right.
But do we need one? Do we need them? Really? Do we need them right across the street from each other? You know, a lot of people are talking about doing this with our fire. You know, should we look at a regional fire and police versus each city right next to each other? The other thing is you're also seeing a lot of things pop up and other things disappear. We are seeing a lot of interventional heart procedures or cardiac cath labs. They're just kind of popping up all over the place.
Well, you know, in defense of that, you hear a lot through media, heart disease. You know, it's in the top 5 killers of Americans. You hear constantly about different things that are happening throughout the country that people need to do to prevent this from happening. So if 2 hospitals each put together an urgent care center, and it's going to service a certain number of the population in there, even if they're next door to each other. I mean, you look at Cleveland, you've got University, you've got the Wade Park Medical Center, you've got Metro Health, you've got Cleveland Clinic. They're all pretty much grouped in the same area. They're servicing the people that can afford them. So what's so wrong with that? I mean, they're being competitive.
Well, there's a couple of things. Let me ask you this. Meanwhile, while all of these heart centers are popping up, where are the children getting health care in Lorain County?
Where are the children getting health care in Lorain County? Well, Where are the children? A lot of them who have working parents are going to the Cleveland clinics,
Right.
going to the neighborhood doctors or wherever,
Now, if there's an emergency,
then they go to that local hospital.
and that local hospital does not have a pediatrics department, so they're then transferred to Cleveland, which is really far for those of you who might not be right from this area.
Akron, that's true.
That's a pretty long haul. So in the meantime, out here you can get a very high profit cardiac procedure anywhere you want, practically.
So what are you saying then, that all procedures should be made available in every city throughout the United States?
No, I'm saying they should be need assessed. And in a single payer system, there's an administrator who's looking and saying, look, we don't necessarily need this on every corner. While at the same time, there are women who have nowhere to give birth because that's not very profitable. And there are children who have to go almost 60 miles to get decent health care in emergency.
Well, now, wait a minute. I think you're being a little bit facetious now. And I'm not trying to defend the present system, but, I mean, even when we had children in our household, we didn't travel any special distance.
Right.
You know?
Yeah, I mean, these are just different kinds of things that under a single-payer system, it really would be a lot more efficient, as I guess
one of the things I don't want to interrupt, but one of the things I heard you say, Eric, is if you have working parents, those children have, there are options where those children go, and the word that jumped out at me is working, and you're right. If people have options and if they're responsible parents, they're probably going to be able to find somewhere to access some care for their child. But who among us is going to make the decision that a child of parents who are not working, or a child of a single parent who's working 3 jobs and can't break away because they'll get fired? There is, in reality, in our society, there are places where you will get fired if you take time off. I don't care what the Family Medical Leave Act says.
I agree with that.
You will lose your job. Who among us wants to say that we want a health care system that says, well, if you have working parents, you'll find a place, but if you're a kid who's in a little bit different situation, it might be a little harder.
And how a single-payer plan
deserve a high-quality, single standard of care? Which child in this country, if we want to really look at ourselves and what we are as Americans and as human beings, which child doesn't deserve that? Which person among us isn't deserving of a single standard of high-quality care in this country? Are we going to make the decision based on whether or not someone's working or not?
Good point. But if I can interject here, I'm sorry. There's an email that I'm going to read this real quick from Judy from Columbiana County to finish her email. She does say, first of all, a big thank you to Debbie in Span, Ohio, for all you are doing to get the people we need what we need and deserve. Healthcare that our political representatives receive and at the same time deny to the rest of us, which you've been discussing. The stories of bankruptcy, divorce due to financial stress from medical expenses, foreclosures, etc. are endless in the U.S. One time I had questioned our PCP at the time about his requiring me and my husband to come in for blood work each and every time a prescription needed refilled. I had explained that in my case in particular, I had an ongoing condition, mitral valve prolapse, which required me, in my case in particular, I had an ongoing condition, which required me to routinely take an antibiotic prior to dental work. This is something I have had to do for better than 20 years and never had to go for blood work in order to get the antibiotic. Having had to change PCPs due to the insurance company, of course, this new PCP was now making us get this extra blood work, which was done in this new PCP's office. And so he was the one profiting from it. However, on my end, I had to miss work, which meant loss of pay, as I have no paid time off in my job. It also required co-pays and out-of-pocket expenses for what should have been no cost to me other than antibiotic. What was his response? He had a staff member call to tell me that me and my husband were no longer patients of his. I could not believe it. Then, when we went to get our records from him for our new PCP, he wanted to charge us $70 each to obtain our records from his office. Beyond the thousands of dollars we have accumulated in debt for health care, prescription drugs, etc. The latest unbelievable experience we had was when we drove past my husband's cardiologist's office to see it empty with a for sale sign in the front. I immediately called the office and was told that they were not permitted by the insurance company to notify any of their patients that they have moved. On top of that, when I said, well, all I need to make an appointment for my husband, who was now overdue for his stress test, he has had 2 heart surgeries, 2 major heart attacks, one in his 40s and the other in his 50s. I was told that they no longer had his records. My husband's own cardiologist had to give up his patient's records because of the insurance company. What if he had had another heart attack? We had no idea any of this had happened, that the cardiologist had moved, his medical records were not on file at the cardiologist's office. Why is it that Dick Cheney, a millionaire, as you mentioned before, is provided the very health care that he denies the rest of us? Again, thank you. You are my heroes in my eyes. For my grandchildren, Judy from Columbiana County.
Judy, you are so right. It's so horrible that you had to go through all of those things. But you know, you're not alone. There's so many people. That's why we're here, and that's why the nurses are fighting for a solution that works for everybody. Everybody deserves quality health care. Nobody should have to fight and go bankrupt and, you know, spend their whole month's, salary on and wonder or sacrifice all of that for food. We really think the nurses, we really believe that our plan to heal America is a good one. We are fighting for it. We'll keep fighting for it. You make some really good points, and sadly there's so many people who are suffering and going through all of these things just like you.
And it's amazing, and we also do have another email. I want to get this in before time's up. This comes from Sarah in Summit County. She writes, so many people call single-payer health care socialized medicine. How do you educate the public that this isn't so?
That's a tough one, because some people that call it socialized medicine, they do that simply because that's what they want to call it. And no matter what you tell them, they're going to believe that that's what it is. But in actuality, the difference, what we're doing here is we're looking at a way of financing health care. We want to continue with the private delivery where you can go to your doctor. Your doctor works, in a private practice or however they do it right now. We are not looking to make doctors employees of the state. We're not looking to have the state go into, or the country go into, the government go into the healthcare business by purchasing hospitals. Those stay the same. We just want to look at a way to finance healthcare so that everybody can access it without going broke. And everybody has an even playing field, and they get the services that they need when they need them. And that's what single payer is. Socialized medicine is when not only is it publicly financed, but you have the doctors are employees of the state or the government, and the hospitals are owned by them.
Okay, we have a little bit of time left. One of the things that I did want to say is that it looks like the person that's making the most to do out of everything here are insurance companies. It seems like we need to actually eliminate them.
What you have to look at with an insurance company is the insurance company is a middleman between you and the commodity of health care. They're in business, they would be considered a no value added process
right
to the final product, because they're just in the way.
Okay. So if anybody wants to align themselves with the single payer plan, how do they go about making that happen?
They visit our website at www.spanohio.org, and that's SPAN spelled with an N. We're not the spam stuff that fills up your mailbox. It's like a bridge span. And there's a place that you can sign up and you can get information from us. If you're listening from another state, you can also visit the SPAN website at spanohio.org and go to our links page, because we have a link to almost every single payer group in the country, from other states as well. The other thing that you can do is that you can visit the National Nurses United website, and you can sign to support their Main Street contract. And their website is at www.mainstreetcontract.org. And you can also sign the petition supporting the financial transactions tax, which would provide a lot of money for these programs that we desperately need.
That's right. That's one of the reasons nurses around the country have joined up with Occupy Wall Street. And we've been saying, it's time to heal Main Street, tax Wall Street. It's essentially just a small tax on the kind of gambling that Wall Street's doing that got us in this mess to begin with. So we want to take it back. Nurses are saying, take it back.
Mm-hmm. I think, Donna, you said it very well when you wrote about the Occupy movement, and you said people don't know what it's all about. Well, what it's about, enough is enough.
Exactly, enough is enough. We all work hard in this country. We all know what's fair and what's right, and it hasn't been fair. The deck's been stacked against a lot of very hardworking people for a very long time. Enough is enough. It's time to make the change.
Okay. I want to thank everybody both in the studio, on the phone, and our listening audience for attending this session of Healthcare for All. And until next month, the third Thursday of every month, we'll see you then.
Yeah, come back next month in December when my guest is going to be Gary Benjamin from UCAN, Ohio, and he is going to talk about why we still need healthcare reform after federal reform.
Okay. Good night, all.
Good night.
Thank you for listening, and join us every third Thursday of the month from 8:30 to 9:30 p.m. Eastern Standard Time on Healthcare for All. Until next time, stay healthy.